Hi everybody, it's Kimberly, and I wanted to hop on and share with you about how do we use thermography. Thermography can do so much, and it's a preventative tool to be able to assess the body for blood flow, lack of blood flow. I'll give you an example. We had a young gentleman come in one time. He was having left-sided pain right below his left breast, and his doctors couldn't figure out. They'd put him on some pain meds, but every time he would get close to being off of his pain meds, he actually could hardly breathe because the pain would just get so intense, and it was in that left upper quadrant of his abdomen. So and he'd been doing this for a long time, but it wasn't resolving his problem. The pain med was not making it better either, and the pain wasn't improving, so he could come off the med. So we did a thermography and found out that it was actually his spleen. He had been in an accident where he was on a tube, an inner tube behind a boat. And he came down really hard on the tube at one point, and he really hurt his spleen. And so we could take that thermography back to his medical doctor and just have them double check his spleen with an ultrasound or a CAT scan MRI to make sure there wasn't any actual lacerations to it or damage done. But the beauty of thermography is you get to take the images and the report from the doctors, as well as we create a whole health history report for you. You can take it to anybody who's on your healthcare team. And I recommend you find your team. If it's a chiropractor, a massage therapist, an acupuncturist, a naturopath, who's ever on your team should have a copy of that, and they should be aware of how to help you improve your health. And then if you were doing a full body or half body where you're checking out organ systems as well as joint health, you want to make sure that's improving. Because whenever I do like a full body and I'm checking the knees or the hips and I see that those joints are warming up and they're not nice and cool like they should be, that means that there's friction happening there, and a lot of times those are wearing down those joints. And we know a lot of people in our country that have hip replacements and knee replacements, and we don't want to be one of those, because sometimes those recoveries are long and hard, and it's really better to keep our joints healthy if at all possible. So thermography is a great way of assessing blood vessel health, achiness in our bodies. There are times that we see people that have achy legs that actually have deep varicose veins they had no idea were there because they just like a Christmas tree. And joint health, as well as we're looking for lack of blood flow. So whenever we see lack of blood flow, that's really important. Like sometimes I don't see people's fingers on their hands or their toes. And so it's really important to have good blood flow, and because that supports our bodies to detoxify. When we do the abdomen, we can see all of the organ systems. When we do the face, we can see dental. We can see sinuses. You have your frontal, your maxillaries are right below your eyes, and your ethmoids along your nose. We can see carotid arteries, which is great. We can see the dental is really interesting, because whenever we check dental and we see a whole bunch of red coming down when there's a dental issue, it's actually like infection that's going down through the lymphatic system into the brachial plexus area. We can see some entrapments where there's some infringements upon different nerves. So there's just some really fun things that you can see. And again, it's tools in your toolbox to help you be aware of what's going on in your body so you can work to improve it so that you stay healthy. I hope you guys have found this is helpful. Feel free to check us out at our website at rafahw.com. And please feel free to call our office, ask questions, connect with us through Facebook, or message us down below if you have any questions. But our goal is always to help you live a healthy life so that you have quality with the quantity of days that you have. I hope you have a great day, and thanks so much for watching.